And we are ready to go.
So thank
So
you
thank you everyone who's logged in right now.
If you
get going and you want to log in as we're moving along, please feel free to do that.
I'm getting a little bit of feedback. So one of the things that we will ask you to do is if you are logged into either our live Zoom meeting or our YouTube live account, if you can go ahead and type your name and your information in, and that'll just serve as a roster for us. So one of the things that we are having to do and navigate around this year is that we're still practicing some social distance. So we're coming at you live from the library, but we have spread apart so that we're able to still have this conversation in person. So, my name is Amanda Engel-Linsky. I am the Executive Director of Be Aware Blount Anti-Drug Coalition. And tonight, we have Kristen Robinson with us from Village Behavioral Health. Kristen is a LADAC. She works with adolescents that struggle with mental health and substance abuse issues. And the point of this evening is for us to really give you all a chance to ask Kristen questions, but for Kristen to present some information to us with a unique perspective that she has. So with that, I'm just going to ask Kristen to just give us a little bit of information about the kids that you work with every day and kind of what your role is with them.
Right. So I work with dual diagnosis, and that is both substance abuse and mental health, ages 13 to 17. And, I've been there for almost 10 years, which is pretty amazing. And I really love what I do because I get to work with parents as well as their kids and help them understand about addiction and just the process of addiction as well.
Can you tell us any trends that you've noticed? So as you've been working with kids for the time that you've been with Village Behavioral Health, and particularly in substance abuse, because that's a topic that we're all super interested in right now. Are you noticing any trends with the kids that you're working with?
Right. Back probably in the 2007, 2008, and the early 2000s, it was marijuana, age 14, as the age of first use. And then over the past few years, that age of first use has really dropped. And in 2014, I remember doing kind of a little survey of the kids, and the age of first use, the median age was age 9. And then here lately, over the past 5 years or so, the age of first use has dropped. And also the first drug that they use is not always marijuana. There's other things, prescription drugs, and even harder drugs. More and more, we're seeing kids start off with opiates because they are under the impression that it's safer because it's a medication. And it is common for kids to, want to experiment with things, but when it comes to experimentation with substances, it can be a first and a last time. So it's really important that we have this discussion.
Absolutely. So one of the things that we've noticed is just like what you said, in our surveys and our data collection, the first age of youth is going down with every passing grade. So where we were looking at middle schoolers and really targeting that age group, now we're really looking at intermediate school and trying to have early interventions there. In Blount County, 60% of kids reported to us when we surveyed 8th, 10th, and 12th graders that a parent doesn't talk to them regularly or has never talked to them about the dangers of prescription drug abuse.
Right.
And so do you have a little bit to say with that as far as the importance of talking to your kids and some tactics for that?
Right. Well, the general consensus with addiction treatment and substance use disorders as a whole is you talk about prevention and then you talk about intervention if necessary. So the prevention conversation needs to start really, really early. And when I say really, really early, it doesn't matter whether you have a family history of substance use or not. Addiction is more than just substances. Addiction is, relationships, codependency, debt, which a lot of our families in America have debt, and people don't really look at that as addiction. There's also gambling, so hoarding and different things like that, eating and things like that. So those are all addictive behaviors. So it has to be considered when you're having the conversation. But if you're one of the few families that doesn't have any type of addiction in their family, you still want to have that conversation because it's rampant in our media and it's rampant in schools, and you want to have your voice being heard among other voices because they're listening to whoever's talking, and if you're not talking, then you can't have your voice being heard by your kid.
What are some ways that parents could talk with their kids about it? So what are some conversation starters? A lot of parents, I think, are intimidated at the idea of like, when do I introduce this topic to my kids? I know I think about that. What is a good age group to start looking at that? And then what would be a successful way to talk about that without it being super off-putting for kids?
Well, I know that there's a lot of cartoons out there that reference drugs. So even though that's not a good thing, it's not good that kids are being exposed. It can also be a conversation starter. So you can play that South Park, maybe not South Park, but you can play that cartoon that talks about substances or makes even kind of a alludes to being high. Sorry, I couldn't think of the word. And then that can be the topic starter. Or you can just ask them, have you ever seen drugs at school? Or have you ever been offered drugs? And then ask them, would they tell you if they were? Because a lot of times parents shut down the conversation way before it started because they overreact when they're talking about other things on the news. If they see something on the news and then they say, oh, that's horrible, then the kid is going to remember that and going to hide it from them. So you want to make sure that you make it an easy opportunity to talk about. And if you do have a freak out session, make sure you have a support group or somebody that you can talk to so that you don't close those doors. The other thing to really think about is, sometimes parents think that if they open the topic that they're going to start something. So if they start talking about drugs, then what if my kid actually starts using because I bring up the topic? You got to remember that the topic's out there. People are talking. They're talking about it at school, in the media. Listen to some of the songs your kids are listening to. And then if you have to, you can go online and see what the lyrics are if you don't understand them. And then, even Google some of the things you don't understand so that you know what they're referencing. And then have a topic of conversation about that. But you definitely don't want to shut down the lines of communication because then your voice is not being heard.
I think what you said
was such a good point about two things. For parents to have a support group themselves, talking about this isn't natural for a lot of people and it isn't normal. So can you talk a little bit about, as a parent, if you're trying to talk to your kids, what might that support look like for them?
Just, a soft place to land, because when you're having your kids tell you stuff that, I have kids that come into my office that tell me things that really, they make me shudder when I think about it. So I can only imagine the parent hearing that same thing. You want to have a reaction that's natural to what your kid's saying. Like, you don't want to seem aloof, but it's also, you don't want to scream at them. You also don't want to start crying or walk away and shut down, which is understandable when you hear some of the things that the kids are saying. You want to have somebody that you trust, that you can go to and you can vent to, whether that's a church group, whether that's just your family circle, or whether it's an Al-Anon meeting, whichever way you want to go. Just have somebody you can vent to.
And then as far as kids go, if you're trying to talk to your kid and you suspect that maybe there's a problem, you don't have evidence, and that's something that I think we hear a lot of, like parents that are like, I think maybe their friends are using, maybe they're using marijuana, maybe they're vaping, but I don't know that for sure.
How would I start that
conversation?
Well, first, you know your kid, baseline behavior and what is normal or natural for that kid. You want to figure out what that is, and then notice, and just genuinely go to them and say, hey, usually you talk to me and now you're not. What's going on? Or usually you're getting up and getting ready for school. What's going on? You want to notice little inconsistencies, because that's the first actual telltale sign is that little tiny things. And then a lot of times parents are just so caught up in their daily life, they miss it. But if you see it and you ask questions, you can cut it off early. Obviously, you don't want to beat yourself up if you missed it, because obviously it's something that the kid is maybe hiding from you, so it's not going to be something that you can see. But there are little inconsistencies. Also, the telltale signs of the physical warning signs of, red eyes, smelling like it, things like that. But a lot of times there's social and personal warning signs as well. So their friends start changing. They don't invite their friends over anymore. Grades drop. They have issues with the school. So there's a lot of different signs that you need to look for, but you know your kid better than anybody else. You know what their baseline behavior, and if anybody doesn't know what baseline is, it's just how they normally act, what they do on a normal, consistent basis. And when they start to kind of alter how they act, that's when you just ask questions. And then you don't go in and ask them in a way that's like, you're interrogating them. You just say, hey, you've been doing this when you used to do that. What's going on?
Mm-hmm. Is there any other tactics as far as if you suspect that they have like contraband in their room, things like that? Like a lot of parents say, well, is that an invasion of privacy if I look, or if I go into their room and they're not there, or what do you think about that?
Well, you're legally and financially responsible for your child. And technically what you have in your home, even if it's your child's possession, it's your responsibility to know what they have in their room. And privacy is definitely something that's earned. And if there's some telltale signs that something's going on, you want to let them understand clear and concise rules that if there's something that they're not being open and honest about, then you may have to go through their things. But you want to let them know that that is something that's your last resort. It'd be much better for your relationship with them if they could be honest and bring it to you rather than you have to find it, because that's a real strain in the relationship, is when they're hiding things. And that's something that you want to have a conversation with them about, how they can be honest, and you're not going to get mad at them. You're going to give them consequences, but you're not going to punish them for being honest.
Mm-hmm. Exactly. And as far as that goes, what should you do if your child starts showing signs that they are abusing drugs and you're suspicious of that? What would be a next step for a parent?
Well, the next step would be to definitely, ask questions, but also reach out. There's so much going on, and there's so many ways to get help. And you don't have to put your kid in a residential facility like Village Behavioral Health right off the bat. You can just ask questions and get them in to see a counselor. That's the best thing to do. And it's one of those things where you have a rapport, a relationship with your child, and you want to have it open communication. You also want to have clear, concise rules. Another thing to mention that it's just kind of the elephant in the room. You've got to look at your own stuff, and you've got to understand if you're sending a mixed message. If you do recreational drug use and it's illegal, then you're sending a very confusing message. Even if you're drinking alcohol and it's legal for you, that can be a very do as I say, not as I do message. So you want to have that conversation. And possibly take a deep dive into what you're doing just to see, what's going on there. And, it's not every parent that has substance abuse issues, but think about the other addictions. Think about codependency. Think about your relationships. Are they healthy? Just take a look at yourself, and then also make sure you get them help of some sort and you go up the chain.
Can you talk at all about if there are certain types of youth or teens, children that are more predisposed to have a substance abuse issue than others?
Well, technically there is, but then there's a whole other question to be answered. the research shows that age of first use, which back in the day was around age 14, but now it's younger, age of first use of any substance, family history of addiction, whether it's substance or otherwise, although people who have a family history of addiction or alcoholism definitely are more genetically predisposed to addiction to substances. And then the last one is co-occurring mental health disorders. And so that depression, that anxiety, any type of things, even ADHD, things like that, what's going to happen is that's going to prime the brain to get more of a euphoria, more of a normalcy from the drug use. And so it's going to be more pleasing to the brain. And so that's going to actually encourage substance use more than just the high, because it's going to be doing a lot more than just getting the person high. So that's age of first use, family history, and also co-occurring mental health disorders. And then what it comes down to is, back in the day, drugs, you had to go to a certain place, you had to know certain people. Nowadays, you can get on the computer and you can buy substances. And actually, Dr. Laura Berman, her 16-year-old son, she's a noted psychologist and relationship therapist who's been seen on Dr. Oz and Oprah Winfrey. Her son bought substances off of the internet and overdosed at age 16, and that was in early February. So it's really important to understand that you can develop substance use disorders even when you don't have a family history. You can actually become the family history in your family. And so drugs are rampant, drugs are very available, and so you have to have that conversation, and you have to have your voice in all of the voices that they are hearing.
And that brings up a good question I had. So a lot of times, some of the feedback that we've heard is, like from parents, does it really matter? Like, I don't feel like my kids listen to anything I say, so why would they listen to my opinions on something like drug use or alcohol or tobacco use? So do you have any thoughts on that as far as how effective is the parent's voice?
Well, believe it or not, your kids are listening. They do care about what you think. Actually, hiding things from you is actually a sign of caring, because I have parents tell me all the time, why did my kid tell you that, not me? Well, I'm just some random person in their life, their therapist at the village. And it's easier, and if you go to therapy, and anybody out there goes to therapy, that's one of the great things about therapy, is that you go in and you tell that person everything, and they don't hold it against you. And so that's the thing. The kids are more open to telling me because they don't care what I think, and they hide it from their parents because they do care what they think, even if it's because they don't want to be grounded, which is the basis of it. But they don't want to be grounded. They also don't want to disappoint them. And so having a conversation with your child about, the only thing that really disappoints me is when you hide things from me, and that disappoints me. So being open, and yeah, maybe I'll get a little freaked out when you tell me things, but I would rather know and us go through this together, because they don't want to be alone. And I'm sure that with their friends and peer pressure, they feel really alone. And think about how your kid comes to you about something that they want, like for a new pair of shoes, or for, a new something, Xbox or whatever. Think about how they're open to coming to you about that. And you can actually use that as an intro to talking to them. You come to me when you want something. I'd like you to come to me when you want advice. Mm-hmm. And that's, you're not, bribing the kid, or you're not like blackmailing them to come and talk to you. You're just pointing it out that, hey, just like you come to me when you have a need for a thing, come to me when you have a need for advice, and I'll be happy to give it to you.
I think that's a great tool, and something that I hadn't even considered, because your kids come to you for the things that they need all the time. So setting that expectation that you want to be that kind of a support is awesome. In terms of other substances, so you mentioned that the example of the child that was able to buy drugs off of the internet, and of course now we know too that other stuff can be bought off of the internet too. So we're particularly concerned about vaping. and the fact that you can buy cartridges that may or may not be nicotine or tobacco products.
Can you talk
about what you're seeing as far as vaping goes with the kids that you work with?
Well, there's still a misnomer that vaping is better for you than smoking cigarettes. And that's quite dangerous, because a little knowledge is a dangerous thing. And we've had a lot more people end up in ERs and in bad conditions because of vaping, and lung condition especially because of vaping. And it's because you're doing so much. You're taking so much into your system. And I'm not an expert on vaping. However, it is, I'll ask a kid, when's the last time you smoked? And they'll say, it's been a year. And I'm like, wow, it's been a year since you smoked. And then they'll volunteer that they vaped a month ago. And so it's like they have already kind of, boxed it off, as compartmentalized it as being different. But and we have to have that conversation about how juuling and cartridges and things like that are really negative, and you're trading one substance for another. And it's really our society is based on, we want to fix addiction by trading one for another. And the rule in recovery is you've got to understand that if you have an issue with addiction, you're going to have an issue. You have the potential to have an issue with anything.
Yeah, I think that's a great point too, because we see that a lot in schools, and we get that feedback a lot. Including marijuana falls into that category of the last student survey that we did. Students were saying, well, it's natural. That was the lowest thing out of everything that they saw as harmful in any substance. So are you seeing anything like that as far as something that's a theme across the clients that you work with?
Oh yeah, because I view alcohol and marijuana a lot alike. And what I'm saying with that is that just because you turn 21 doesn't mean you suddenly have the ability to control your use. If you're an alcoholic and you turn 21, you're still going to have issues with alcoholism, despite it being legal for you. And a lot of the kids tell me, well, what about when marijuana becomes legal? Well, in NA and 12 steps, they say you use it and you have allergic reaction because you break out in handcuffs. I think that's funny. And you can still have that happen. You can still go to jail for using marijuana, even though it may be recreational and it may be legal in the state. It's not currently legal in Tennessee for recreational. And it's the same thing as alcohol. You can still get DUIs even though you're over the age of 21 and alcohol is legal. And addiction is something that if you try to control it, your brain actually makes you feel like you control it, and you can't. So it makes up, your brain makes up different excuses or rationalizations that actually lead to denial, and denial leads to more of a problem. And the only thing that can really break that whole cycle is consequences. And somebody who has the ability to use something that's legal, they can still have consequences.
Yeah, that's exactly
it. It doesn't, if anything, now in Tennessee, because you have to be 21 to use tobacco or alcohol, what that really just says is any of those consequences now are on your permanent record.
Right.
Because you're an adult. So because we get that pushback a lot. I wanted to talk just quickly on access. That's the thing that our coalition is very concerned about right now. Something that kids have been giving us feedback on for years, which is that it's not hard for them to get whatever they want. And in fact, a lot of our kids are purchasing things from retail stores. So we know, of course, that if we can limit that access, then it's going to really limit the amount that they're able to use something. What do you think about that in terms of people in their own homes?
It's kind of like media. It's always going to be there. It's always going to be accessible. And it really comes down to just being aware and doing what you can in your home to educate and help them understand how to make a healthy decision. And again, the reason that it's really important to do that is that you're legally and financially responsible for them. I have with parents who say, well, I'm just going to kick my kid out. Well, that's not a good idea because you're legally and financially responsible for them and you could actually be charged. So keep in mind that you are legally bound to them and financially bound to them because they are your child. And it's important for you to know what's going on in your home. And when it comes right down to it, you have to do what's best for you. And we can't change society. What we can do is we can be a voice in our homes so that our kids know where we stand. The worst thing in my mind is for your kid not to hear you say that a substance is bad. Or something else that's very dangerous is parents who allow their kids to use drugs in their home thinking that they're doing something that's good. And it's a slippery slope because you are kind of managing what they're doing, but you're teaching them to do something that's illegal, and they're going to take that and they're going to run with it. They're going to do other things that are illegal and possibly hide that from you because, and the worst thing about that is you've actually taught them to do things that are illegal. The stance needs to be, it's illegal, and I'm going to do what I have to do if I see you doing it. Obviously, you don't want to start off with that type of hard approach. You want to help them understand that it's important for them to be honest with you. And this is what I say with the kids that I work with. Honesty goes a long way. And for me to be able to believe you and to be able to trust what you're saying, then I can actually stick up for you if somebody's saying that you're a liar or saying that what you're saying is not truthful. And so that's what you need to be able to say to your kid is, I need to be able to trust you so that I can back you up. If you say you didn't do it and you've lied to me several times, I'm not going to be able to confidently back you up. And that's going to be hard. However, you also don't need to, if your kid does get into legal trouble, you don't need to be right beside them. And you don't also need to hitch your wagon to that and then make authorities under the impression that you can't figure out who the adult in the scenario is.
And another thing that I would add to that as well is if you have any kind of prescription drugs in your home, you can definitely get a free medical lockbox from our coalition. We hand those out to anyone in the community that needs them, and we ask that you lock those meds. Even if you have kids that you think don't have any issues at all, we definitely want to encourage that behavior, and especially if your kids are struggling. You want to lock up your alcohol if you have that in your home. You want to lock up your prescription medications.
Definitely.
So we want to make that available. If anyone ever needs a medical lockbox, they can definitely get that from us.
I always say too to count your pills and keep up with that, especially if you have teenagers, and that's just for your own peace of mind. You don't have to tell them you think that they're taking them. You can just have that in your mind as evidence of whether you should start a conversation. And you can also have a certain pattern that you put the medication in. Maybe it's A through Z or things like that. And that way you can know just by eyeballing whether they've touched it or anything like that. And, also trying to keep it where it's not as accessible, where it's not easy to get to, because when they have friends over, they might start thinking and they might just do something that's very impulsive. And it's just the accessibility. It's always going to be in the community. And just like you said, it doesn't have to be accessible in the home.
Yep. To build on that too, so we would ask that you count your meds, lock your meds up, and then when you're finished with any kind of expired, unused, or unwanted medications, whether they're controlled or not, we actually have a drug drop box in Blount County at the Justice Center, and so you can anonymously drop off any of your medications there, and those will be properly disposed of. So we always encourage people, don't keep that in your house. It puts yourself at risk, and then it puts everyone else in your home at risk as well. So
definitely. And there's things called farm parties, PHARM, PHARM. And that's where kids are told to bring medication, and then they dump it into a bowl and they all just stick their hand in and take it them. So that, is scary to me, because how these kids don't die of overdoses is quite mind-boggling. And then a lot of times you have other substances, including alcohol, on top of that. And a fun time should not end in death. And while experimentation is a part of teen years and, the formation of, who they are and their identity, experimentation can be deadly. And so we really have to push home this point that, you don't want to be a part of it, number one. You don't want to be giving them access to it, because then you're going to feel responsible if something does happen. So you're doing it for yourself just as much as you are for your kid by keeping that access away from them, because then you're going to also understand you did everything you could to be able to prevent it.
I think that's exactly
right. Do you have any other thoughts to share with parents? And these are maybe parents that haven't quite dealt with the level of the things that you deal with your clients, but maybe they're just wanting to prevent that ahead of time.
Well, it's important to understand that if your kid plays sports and gets hurt, it's important to just be very cautious of any substances, I shouldn't say substances, any medication that they're prescribed, and just keep track of that, because a lot of people who develop addiction, whether they're in their teen years or in older years, they basically get prescribed it and then they start to misuse it. So it's really important to keep track of that. The other thing is curiosity, as I spoke to before, is a part of being a teen. And a lot of parents say, oh, they're just experimenting. And it's true that drugs have been around for a really long time, but things are getting to an epidemic proportion. In my mind, we've had a pandemic way before COVID-19. We've had a pandemic of addiction for a really, really long time, and it's impacted a lot of people. During COVID-19, a lot of isolation and a lot of people trying to find different ways to cope, have fun, has led to substance use. So it's just really important that we have this conversation and we continue to have the conversation.
I think that's great.
Well, I want to open it up to any questions. If anyone is watching on a stream and they have a question for Kristen, you can shoot that in the chat box and we will ask her. If it's something a little bit more personal or private, you can always send it to us anonymously. And that you can email it a question if you have it at info@beawareblount.org. Be sure to get that to her. So I'm going to check if we have any questions. And then Kristen, do you have any other thoughts on any of the other trends that you're seeing with the kids that you're working with, or if you want to talk a little bit about your Thrive curriculum?
So Thrive is thorough, healthy recovery in various environments, and it's created because the patient or the teen is coming out of an environment and going back to that environment. And so instead of having the environment change, we have them gain skills. And the way that we put it at Thrive is, if somebody's drowning in the ocean, they need to learn scuba skills so that they can go back and breathe underwater and thrive. And so the Thrive program has scuba skills instead of self-contained underwater breathing apparatus. Scuba skills are self-control, communication, understanding, and understanding has a lot of different categories under understanding, like understanding addiction, understanding recovery, understanding yourself, understanding relationships. And then B stands for balance and boundaries. And then A stands for attitude, because recovery is different than being clean. There's a lot of people who are clean, but they have a bad attitude. So attitude is one of the biggest parts of recovery, because I can actually tell if somebody's in active recovery by their attitude about life and about what's going on. And it's not that they have to be super happy about things that happen that are negative. It's just they have a more balanced approach to it, and they understand something is always there to be grateful for, regardless of your circumstance.
All right, I think that's great. We appreciate you being here with us today. We are going to continue doing some series of trainings. Hopefully those will open up into in-person events as the year progresses on. We are very hopeful of that. And I just wanted to kind of close by saying that with Be Aware Blount, we are your local anti-drug coalition. It's a membership that's open to the entire community, so you don't have to be associated with any particular groups or volunteer agencies or anything like that. It's open to anyone that has a vested interest in preventing substance abuse issues in Blount County. So if you're interested in knowing more about that, we have meetings once a month, which is open to the public, and you can email us or reach out to us here, or you can email us at info@beawareblount.org.
So we
want to thank everyone that took the time to
drop onto
it. I see there are several of you that are listening, and we appreciate that. And if you have thoughts or ideas on topics that you want to hear more about, we certainly want to hear that as well. So definitely shoot us a message and we will respond. So on that note, we're going to hop off here. Thank you again, Kristen, for being here today, and we hope to talk with you all soon.